One of the most common areas of my practice is implant revision surgery. I see this from time to time in women who've had implants and require some type of improvement in the position of the implant in order to have a more aesthetic, pleasing outcome. And this is one of the more common. This is called inframammary fold failure, also known as bottoming out. This is where the implant drops too low, lower than it was supposed to be, lower than where the original incision was made to place the implant, and it requires a repair. You can see in this patient, I want to show you before and after to give you an idea of just how much the implant dropped by noticing this little freckle here. And this is about an inch above where her fold is. And then afterwards, where the freckle is again, which is approximately where the breast crease is now. And this bottoming out effect can occur. It's primarily associated with under the muscle implants, and one of the disadvantages, I think, of under the muscle implants, even though I still think it's the preferred approach. Because this is an issue that I've seen many times over the years, when I do a primary breast augmentation, that is place an implant for the first time in a patient, I will do a prophylactic fixation of the fold in order to prevent this problem from happening. So I see very few of these in my own practice, but nevertheless, occasionally I do, or I see patients from other places who've come in and the position of their implants is not ideal and want it fixed. One of the things that happens with fold failure, inframammary fold failure, or bottoming out, is loss of fullness in the upper part of the breast. Because the implant is too low, there's very little implant above the nipple. It also causes the nipples to point upward, and the nipples can actually peek out of a two-piece swimsuit, and that can be very annoying. So it's not really the position of the nipple that's the problem, but rather the position of the fold. Because when the distance between the nipple and the fold, also known as the vertical distance, elongates, it causes the nipple to come upward as the implant drops down. So the fold in this patient was raised about 3 centimeters or a little over an inch, and the nipple now points forward. There's much better fullness in the upper part of the breast, and overall an aesthetic natural outcome. Afterwards, the fold is actually tucked up, and another thing that you can see in this is the change in the contour of the breast. This is a more or less flat profile along the lower pole, that is the lower portion of the breast. And now it has that nice curve that it's supposed to have after the fold has been lifted about an inch or so. And again, it can be seen in this view, and I'm gonna just point out that that little freckle was here before, which is about an inch above the level of the fold, and now it's approximately at the level of the fold, that same freckle. I hope you can see that. But it changes the contour of the breast to one that's much more aesthetic. In addition, another important thing to notice is that when the implant is too low, then oftentimes there's inadequate fullness in the upper part of the breast, or the upper pole. And you can see how there's kind of a contour depression of the upper breast, inadequate fullness in the upper breast, which is not ideal, and often a concern of many women who come in. And then afterwards, by raising the fold, the implant can be pushed upward and improve fullness in the upper part of the breast. I hope you enjoyed that, and look forward to more videos in the future about the various types of things that we do to improve situations that occur after implant placement.